Placenta previa, a condition in pregnancy where the placenta abnormally implants in the lower uterus, poses significant risk to both mother and baby. This condition requires careful management to mitigate potential complications. Healthcare providers involved in maternal fetal care must understand its nuances and complexities. This presentation aims to explore placenta previa comprehensively, covering its definition, pathophysiology, clinical presentation, diagnosis management, and nursing considerations. By equipping healthcare professionals with this knowledge, we can enhance patient care and patient outcomes.
Definition and pathophysiology. Placenta previa results from abnormal trophoblastic invasion during early placental development. Factors such as advanced maternal age and previous cesarean births elevate its risk. The abnormal implantation obstructs the cervix, leading to complication during pregnancy. Understanding the pathophysiology of placenta previa is crucial for identifying and managing it effectively, reducing risk to both the mother and the fetus. Predisposing factors. Placenta previa is associated with several predisposing factors that increase the risk of its occurrence. These factors include increased parity, particularly a history of multiple deliveries, whether alive or dead, advanced maternal age, past cesarean births, and previous uterine curettage commonly performed during abortions also heighten the risk. Multiple gestation tend to displace the location of the placenta, while pregnancies with male fetuses due to their larger size may displace the placenta further. Understanding these predisposing factors is essential for identifying women at higher risk and providing appropriate monitoring and management throughout pregnancy.
4 types of placenta previa. Placenta previa can present in 4 distinct types, each with varying degrees of severity and implications for delivery. Low-lying placenta involves implantation in the lower rather than the upper portion of the uterus and may allow for the normal spontaneous delivery. Marginal implantation occurs when the placenta edge approaches the cervical opening but doesn't cover it entirely, also typically allowing for a normal spontaneous delivery. Partial placenta previa involves implantation that includes a portion of the cervical opening, sometimes leading to a decision for either a normal spontaneous delivery or cesarean section delivery. Total or complete placenta previa involves implantation that entirely obstructs the cervical opening, cesarean section delivery to avoid complications.
Assessment. Assessment of placenta previa involves various considerations to ensure timely intervention and appropriate management. Bleeding typically begins when the lower uterine segment differentiates from the upper segment late in pregnancy, around week 30, and the cervix begins to dilate. The bleeding, characterized by abrupt, painless, bright red bleeding, often results from the placenta's inability to stretch to accommodate the differing shape of the lower uterine segment or the cervix. Additionally, a soft, non-tender, relaxed uterus and the presenting part being the placenta rather than engagement of the baby are characteristics findings. Understanding this assessment parameters helps healthcare providers identify placenta previa and initiate appropriate interventions promptly.
Clinical presentation. Painless vaginal bleeding characterizes placenta previa in the 3rd trimester, often as a sudden onset. This bleeding arises as the lower uterine segment differentiates and the cervix dilates, causing disruption to the placenta. Prompt recognition of painless bleeding is essential for timely intervention and preventing severe complications such as hemorrhage and shock. Complications. Placenta previa can result in severe complications including hemorrhage, maternal shock, fetal distress, growth restriction, and infection.
Hemorrhage, in particular, poses an immediate threat to maternal and fetal health and requires urgent intervention. Maternal shock and fetal distress necessitates close monitoring and rapid response to prevent adverse outcomes. Early recognition and appropriate management are critical for mitigating complications associated with placenta previa.
For the diagnosis, diagnosing a placenta previa involves a combination of ultrasound and clinical assessment. Transabdominal and transvaginal ultrasounds are utilized to visualize the placental position relative to the cervix. Early and accurate diagnosis is essential for guiding appropriate management strategies and optimizing maternal and fetal outcomes. Healthcare providers must be skilled in recognizing the signs and symptoms of placenta previa to initiate timely interventions. For the management, managing a placenta previa encompasses various interventions, including bed rest, vital signs monitoring, blood transfusion, delivery planning, and corticosteroid administration. These strategies aim to optimize maternal and fetal well-being while minimizing the risk. Bed rest reduces the risk of further bleeding and facilitates close monitoring of maternal and fetal status. Blood transfusion may be necessary to restore maternal hemodynamics and to prevent shock.
Nursing considerations. Nurses play a pivotal role in supporting patients with placenta previa by providing education, emotional support, and vigilant monitoring. Their expertise in recognizing and addressing complications significantly contributes to patient care and outcomes. Nurses must possess comprehensive knowledge of placenta previa and its management to deliver optimal support to patients and their families. Effective communication and collaboration among healthcare team and members are essential for ensuring coordinated care and positive outcomes.
So, in conclusion, placenta previa necessitates a multidisciplinary approach for effective management. Understanding its complexities and addressing its challenges are paramount for delivering optimal care to patients. So, by comprehensively addressing the definition, pathophysiology, clinical presentation, diagnosis, management, and nursing considerations of placenta previa, healthcare providers can enhance patient outcomes and ensure the well-being for both mother and the baby. So let us remain vigilant and proactive in our efforts to manage placenta previa and safeguard maternal and fetal health.